Good afternoon, everyone. I hope you can hear me okay. My name is Chen. I'm the Chief of Medicine at Henry Ford Hospital, West Bloomfield, and I'm also a specialist in infectious diseases. I'm the Program Director of Infectious Diseases at Henry Ford Hospital, Detroit, and I was formerly the Division Head of Infectious Diseases here at West Bloomfield Hospital as well. It's my pleasure to be here today. I was asked to just present a couple basic slides, just kind of giving an overview and some basic information that we thought might be helpful to everyone on COVID. And maybe I'll do that for the first 15 to 20 minutes, and then the last 15 minutes, I'd love to take your questions and see if there's anything I can help answer for you. So today, I don't have any disclosures. I am not a paid consultant for any company. So just giving an overview of COVID, and actually ignore this little blip right here. One thing I wanted to point out too is COVID is actually still very present in our community. We had an uprise back in March and April. That's when you first see this first rise, and things got a lot better. We had a lockdown in Michigan, and things went to an all-time low at the middle of June, and we were at an all-time low of cases in Michigan. But you can see what's happened over the last couple months, especially in September and now into October. We have been steadily growing in the number of COVID cases in Michigan, more so than we've ever had before, actually, during this whole pandemic. So unfortunately, right now, we're on the upswing, and we are having increasing COVID numbers greater than we've ever had before. So I think that's important to note, because I think it's important for us to be aware of our risks and make sure we can be as safe as possible. So this is taken from the CDC, and this is just Michigan's cases. I wanted to give you some basic information because I think this is really important about how do we get COVID? How does somebody get infected? I think most people, including Dr. Fauci and all the infectious disease specialists, would attest that probably more than 99% of the cases of COVID are through the air. They're mostly droplet, and rare cases would be airborne, but essentially we get it by breathing in COVID that's in the air from someone else who's infected. Now, it is true, it would be possible in rare cases to get COVID through touching something. And that would be unusual, but it is possible. So for instance, if someone had COVID and they coughed onto a door, onto their hand, and then touched the door handle, and then you touched the door handle, then you took that fresh sample and touched your eyes and touched your mouth and put your fingers in your mouth, is it possible that you could get COVID? It is possible. But I think based on the evidence and the research that we have so far across the world, there's no question that almost all cases of COVID, almost all are through the air. That's really the vast majority. And the reason I'm emphasizing this, it's part of our strategy on how we can keep everyone safe from getting COVID. And we'll have more slides on that later. But that is very, very important on the major way that we are COVID transmission is through the air. Now, symptoms are a range of symptoms. Now, we actually have data so far across the world that potentially 1/5 or 20% of people who actually have COVID right now don't have any symptoms at all. So you can feel 100% fine, have no symptoms at all, and actually possibly have COVID right now. And the reason that's important is the people without symptoms but who have COVID, they're still equally infectious. They can infect other people who could get very, very sick. So that is important to recognize, really important, that even if the person you're with, your friend or a distant relative or a close relative has no symptoms, it doesn't mean that they don't have COVID. And that's why that's one of the reasons COVID is spreading to even higher numbers right now, because I think people think, oh, if I have no symptoms, I don't need to wear a mask. There's no worry for me or anyone I love, but that's not true. So I wanted to make sure you understood that. We have people who have mild symptoms that could be fatigue, maybe losing appetite. You've heard of people losing their sense of taste or sense of smell, cough, like a runny nose, a headache, upper respiratory symptoms, maybe sinus pressure, fever, diarrhea. And you can see these symptoms are not specific. In fact, I would guess that many times someone has these symptoms, it could just be a common cold, it could be another virus, it could be, many other things besides COVID. So these symptoms doesn't mean you definitely have COVID. However, you could have COVID. So that is why it's kind of tricky. Now, if in some patients, less than 20%, their COVID will progress and become severe. And this is really a very dangerous situation and actually is life-threatening. If you have been diagnosed with COVID or have had these symptoms of fever or cough or loss of appetite, and then it starts to become difficult for you to breathe. When you're walking up the stairs or when you're walking, you're noticing it's difficult to breathe. That's actually very dangerous. It means that COVID has spread to your lungs and you have COVID pneumonia. And these are the people that are being admitted to the hospital and are very ill. So we would want you to seek medical attention as quickly as possible. And hopefully you've even been seen by a doctor earlier than this when you first had your symptoms. And in very rare cases, people go on to get even sicker and go to the ICU and have a damage to different parts of their body, including their kidneys and their other organs as well. I did want to mention to you, because sometimes it's especially important for us to protect ourselves. If people ask, am I at increased risk of getting COVID? Well, actually, the people who are at greatest risk of getting COVID are the people who are not practicing proper social distancing and wearing masks. And again, we're going to reemphasize this later in the talk. But in terms of medical conditions that would increase your risk of doing poorly with COVID, one would be increasing elderly age. So if you're over 65, 75, 80 years old, your risk of having a complicated course with COVID increases. And then things like high blood pressure, diabetes, obesity, lung disease, heart disease, those things can also increase your risk. So I have great and promising news for you. We have really come so far in the treatment of COVID in the past 6 to 8 months. Here at Henry Ford, we've made amazing advances and things that we're really proud of at Henry Ford. We've actually always been able to test our own patients from COVID from the beginning, and we can turn around that test very quickly. I know, and we were actually the first in the state to perform the test, the COVID test, so we're very proud of that. We've been testing since March within our own system. We don't send it out. We've come so far, not just Henry Ford, but the healthcare in general. We know, because we're testing broadly now, we know it's important to get tested as soon as you have symptoms. You should not wait. If you have any symptoms at all, you should be tested. And you know, one of the most important reasons to do that is to protect your loved ones. Because if you know you have COVID, you actually have to quarantine and stay away from your friends and family for 14 days. Otherwise, you'll infect them. And so if you don't get tested and you see other people, then you could become highly infectious and hurt and infect other people. We've come so far in understanding the best ways to prevent COVID. And again, I'm saving the best for last. We're going to really emphasize how we can protect each other and keep ourselves safe. And we've come a long way. And this is all based on evidence. We have hard evidence of this. So I'm going to be eager to share that to you. We know how to monitor for the symptoms that would be increasing our risk of doing poorly. And that includes what I was mentioning to you, maybe difficulty breathing. We've actually come a long way in knowing how to treat COVID. So we don't treat COVID if you're not very ill. If you have mild symptoms and your doctor advises you to stay at home, there is no treatment at home. But if you get to a very severe stage where you're having lung damage and your lungs are being infected, we do have treatment now. It is approved by the FDA. So we do have treatments now that we didn't have before. So I wanted to tell you, we have come a long way in that as well. And at Henry Ford, we've seen literally hundreds and over 1,000 patients with COVID. We've actually helped to lead the country with, determining best treatment. And I have some great slides to show you. So what you'll see in this slide, and this is a little bit outdated, but you can see we had the big rise in March, April of these are COVID cases at the top. And then we had a decrease down to June and very few COVID cases. And then actually, we had COVID start to increase. And if I were to print out that old chart, this would actually keep going up and up and up. So these are our total COVID cases in Michigan, and they're going up. But you can see at the bottom here, this is how many deaths we've had from COVID each day. And what you can see is in the beginning, we had a tremendous number of people do very poorly and pass away from COVID in March and April. But look at this curve. It's done so well, even though you can see that our cases have doubled and tripled and quadrupled since June. And our cases are way up here. We actually had like 2,000 cases yesterday. Even though we had more cases yesterday than we did in March and April, our mortality and our deaths is now very little. And so I wanted to share that very encouraging and promising news with you that we are making tremendous advances in understanding COVID and being able to take care of COVID. And this is what we saw here in Henry Ford. We adapted quickly. We had a lot of information that we understood, and we were able to make some tremendous differences in saving lives. So that was great news. So I wanted to bring up a couple really important points. You know, there have been a tremendous number of deaths in the United States now from COVID. My understanding is over almost 250,000 deaths from COVID in the United States, which is just earth-shattering numbers. I'm sorry, 250,000 cases. But what I wanted to tell you is that for all of the deaths that we've had directly from COVID, it's been equally tragic that a lot of people have been scared to seek medical help for other reasons and have been avoiding visiting their doctors. So there have been tens of thousands of people who have passed away in the last 6 months for reasons completely unrelated to COVID. They might have been having a heart attack, or they were afraid to get follow-up care for a medical condition such as heart disease, or maybe they were having a stroke, or maybe they had some symptoms but were afraid to see the doctor because of COVID. So they put off finding out about a cancer diagnosis, and maybe we could have treated the cancer very quickly and gotten it under control. So there have been many, many articles published in all the newspapers, you know, Wall Street Week, New York Times, CNN, showing that it's been very tragic. A lot of people have been scared to seek medical care. So I'm here to try and reassure you that going to the doctor and seeking medical care is one of the safest places you can be. And I'm going to show you in our next slide how we keep you so safe. But I wanted to emphasize to you, you should not be cutting back on any of your medical care. I have parents who are 85 years old here in town, and I'm telling them, you got to see your ophthalmologist, you have to get your well visit, you have to, go see your regular checkup, and all the things that they normally do. I tell them you can't put it off. There's no reason to delay. You need to go see. These are all things that are keeping you healthy. And that especially means your flu shot this year. I'm just going to spend a minute talking about the flu shot. The reason it's so critical that you get your flu shot this year, influenza or flu has almost the exact same symptoms as COVID. And we really would love to try and eliminate and decrease any episodes of flu this winter, because I think everyone's going to be quite alarmed when they start having symptoms and you have to start thinking to yourself, wow, is that flu that I have, or is this COVID that I have? So if we could just eliminate all disease, that would be fabulous. We don't yet have a vaccine for COVID, but we've had a vaccine for flu for many decades. And it is standard of care in this country for every single person to get a flu shot. It has been for many, many years. And so if you can get your flu shot right away, that will help keep you safer this winter so that you don't get any symptoms at all. And you don't have to worry when about getting the flu and then worrying, is it flu, is it COVID? We would just love to get this taken care of so you can stay safe. So that I would urge you, I got my kids to get their flu shots, my in-laws, my parents. Right away, I made that flu shot appointment for them. So please go get your flu shot right away. But just to finish up this slide, any routine tests or procedures, you should still continue to get them. You should see your doctor for your medical conditions, and especially if you have any new symptoms. Please don't put it off. And I'll be very, very blunt with you. We don't know when COVID's going to be done. I know we're hopeful. I hope we'll have a vaccine. I hope we can cure COVID. But it may be possible we still have COVID in a year from now. And so there's no end in sight at the current time. It's not that COVID's going to be completely gone in 1 or 2 months. So we just have to be prepared. This is our new norm, and we should continue to take care of ourselves with best medical care. Let me go to the next slide. So how do we keep you safe? Because it's actually my 85-year-old in-law said the same thing to me. Oh, I can't go to the doctor's office. I'm going to get COVID. Absolutely not. I can tell you, being in a medical setting, being here at Henry Ford is the safest place you can be and not get COVID, except if you were quarantining in your own house with no visitor. So I will tell you, if you're quarantining in your own house and never seeing anyone, that is the safest condition. If you're going to leave your house, going into a medical center is the second safest place you can be. And let me explain to you why coming into a medical center, seeing your medical doctor in their clinic is safer than, say, going into a grocery store or going grocery shopping or going to a restaurant. Here in the hospital, we do so many things, and we do this in all of our clinics as well, that they don't do in the normal environment. So if you go grocery shopping, we do things above and beyond. We do meticulous, intense cleaning protocols every couple hours throughout our facility. We have exceptional advice by infection control specialists on a daily basis. We require everyone who's entering our facility to wear a mask correctly. And not only do we do that, we screen every visitor into our facility and our offices with, whether it's symptoms we are screening them with, potentially temperature checks. These are all things that are not standard in public. If you go grocery shopping, they're not taking your temperature, they're not screening you. We're really strict on social distancing here. So we're doing all these things that are above and beyond. And then in a medical environment, the airflow, the HEPA filtration, the ventilation and filtration of the air here is medical grade filtration. So again, this is so much safer than all the other things that we're doing on a daily basis, such as grocery shopping, going to a restaurant and getting carry out. So I just want to emphasize how safe the medical environment is here in the medical offices, here at Henry Ford, here at our hospital. Other than your home with no visitors, this is the next safest place you could be. I'm just going to finish up a couple more slides. I think some people have been interested in vaccines. So what I can tell you is there's many, many vaccines being developed, and we don't know yet which ones are the best ones. There's been a couple trials that have completed. Henry Ford participated in the first one that was Moderna, which is the name of a company. And there's another trial that was recently completed. Now we're entering into another trial called by Johnson & Johnson, which is another vaccine trial. And again, Henry Ford is participating in that. And in case you're interested, it's a random lottery based on your risk factors, and you could go to the Henry Ford website to try to enroll. We have probably 10 times more people who are trying to enroll than we have spots for. So it's based on criteria determined by the company. But what I wanted to tell you is there is not yet a vaccine approved in the United States for the treatment of COVID. We're working on it aggressively. In fact, the government of our country has personally given billions of dollars in the last couple months to try to accelerate this process from a couple years to as quickly as possible. There are other countries who are mass producing and giving vaccines, but those have not completed the rigorous safety standards that we require here. So when you ask yourself, well, why is this other country saying that they have vaccine? They are kind of skipping some of the safety steps we are not willing to skip here. So we are going to do this safely and make sure that when we roll out a vaccine in the United States, it is absolutely safe for you. But we are getting very close, and we are hopeful that probably, I would hope by 2021, hopefully the earlier part of 2021, we may hope to get a vaccine. We may get it in very limited use at the end of this year. Again, we'll have to wait and see. So we can't really, I can't really anticipate how quickly that's going to be. Our hope is that we can find an effective vaccine, because short of waiting for everyone to get COVID, which we certainly don't want, because there's too many people who suffer greatly with that and even lose their lives, the next best thing to safely get our country out of this pandemic is to vaccinate everyone and give everyone protection, so that we don't get this, just like influenza. We're able to protect people from the flu. I only have 2 more slides, and then I'm going to open it up for questions. It's kind of a busy slide, but what I wanted to tell you, and this is what I'm going to show you in the last slide, how do we keep people safe? So on the left column in dark blue is the person with COVID, and then the right column in light blue is the person without COVID. At the very bottom, the very safest way for no one to get COVID is if you quarantine in your own house and never see anyone. But that's not realistic. It's not realistic that we don't go grocery shopping and we never see anyone at all. But if you did that, your risk would be 0. The next best thing, which is what we've been recommending in this country by the CDC and you know, our own government and within Michigan, is the very low risk. What everyone can do is they're wearing a mask, which you can see in white, and you can wear any good mask, which is 2 or 3 layers that you can't see through. Wear a mask. Everyone wears a mask, and ideally, if you can stay 6 feet apart. Your risk of getting COVID, even if one of the 2 people had COVID, your risk would be very, very low, less than 1% chance. So even if you were standing 6 feet apart from someone else who had COVID, if both of you are wearing masks and you stay over 6 feet apart and you're not in a small space for a very long time, your risk would be very, very low to get COVID. Now, above that, your risk starts increasing when you are closer together than 6 feet. So if you're 1 foot away or 2 feet away from a long period of time, your risk starts increasing more. Then your risk increases further if the person without COVID is not wearing a mask. So if one of the 2 people is not wearing a mask, now the person with COVID has a mask, but the person without COVID doesn't have a mask, you have a medium risk that you'll get COVID from them. And then a very high risk is the person with COVID is not wearing a mask. So this is why it's so important, even if you're wearing a mask, you need to insist that everyone around you is wearing a mask. Because if you're wearing a mask, but the person with COVID is not wearing a mask, your risk of getting COVID is still high. And certainly if both of you are not wearing a mask, it's very, very high. So I did want to say one thing about this, and I'm going to go to my last slide. We are seeing cases in the hospital of very sick patients with COVID. And almost every case I've seen in the last 2-3 months, they were people who got COVID from a family member. What happened is you typically have someone who might be a little bit older and they had a younger nephew or a grandchild or a daughter who had COVID, and then they got COVID. So I would say we all love our relatives immensely, and there's a way to see them safely. What I would say is, if you're not part of the family that lives together in the same household all day long, what I would say is when you visit with your extended family members and or your friends, even though no one has symptoms, let's protect each other. Let's keep everyone safe. This is our way to show, keep everyone healthy. Everyone should be wearing masks because even without symptoms, someone could have active COVID and unintentionally infect their friends and family. So this is my very last slide. How can we stay safe? And I have, even though I have, again, elderly parents, elderly grandparents over 85, I feel very comfortable that there's that they're going to stay safe because they're following these things. And this is what I want you to do. I think it is important when you go out to use hand hygiene, wash your hands, use the alcohol disinfectant. But the most important things is everyone wearing a mask. And that includes when you see your extended grandchildren and your nieces and nephews and your children that you don't live with. Everyone should wear a mask. Ideally, if you guys could hang out, 6 feet apart, that would be ideal. And you're going to follow that social distancing of 6 feet apart when you're out in public, doing grocery shopping or what have you. And then, as I said, hand hygiene as well. So these are it's very basic. Our country hasn't done a good job obeying these rules as a whole. You may be doing a very good job, but if you ask, is every single person in this country doing this? Unfortunately, the answer is no. But if you look at other countries across the world who have done this, their rates of COVID are near zero. They've done so well and kept everyone safe. So I leave you with this helpful, hopeful piece of advice. We can keep each other safe, and you can control your future as much as possible and really minimize your risk by being safe, using masks, socially distancing over 6 feet whenever possible, washing your hands, and really you can diminish and insist that people around you wear masks. You can really decrease your risk of COVID to very, very little risk. So I think that's very hopeful, and I am very optimistic that we will get through this quickly and get everyone back to safe conditions. So let me stop this and see if I can take some questions. I don't know. Let's see if I can stop sharing this. I don't know if anyone can hear me. I would love to take any questions. Okay, perfect. Okay. So if anyone has any questions, I'd love you to start typing. I don't see any questions yet. I think there have been a lot of myths about COVID, which I can talk about while we're waiting for anybody to put in a question in the next 2 or 3 minutes, because we are almost out of time. Alcohol and disinfectant on surfaces such as desks and your hands is okay. Trying to drink a disinfectant or alcohol is not helpful and in fact could be very harmful. We know that high temperatures as well as cold temperatures are not effective for COVID. We know that you cannot get COVID through telephone waves, which I think was a myth out there. There have been almost no cases of COVID transmitted through pets, so that's not really a concern as well. We know that COVID is very different than the flu in terms of how dangerous it can be. So very few people. There are some serious patients who have a very serious illness with flu, but the rates of having very serious illness with COVID is much, much more severe. So it's not accurate to say flu and COVID are similar and getting COVID is no different than the flu. In some patients, it's no different, but in other patients and more patients, doing poorly with COVID is much more common. So they are not equal. COVID is much more serious a diagnosis than getting the flu in general. Okay, so I think we have, I think we just, I don't see any other questions. Let's see. Oh, Dr. Flynn or Gregory Flynn, can you speak to the rapid test reliability? Thank you. I got one question. I'm so excited. We find the rapid test to be highly unreliable. It has false positives and a high rate of false negatives. We've never done it at Henry Ford because the numbers are so unreliable. I guess the only way it would be helpful, so let me start by saying we always do the PCR here, and that is considered the gold standard for reliability is doing a PCR. I think they're developing new tests that use PCR and are quicker. The PCR itself only takes a couple hours. It's actually very quick. It just depends on where you're getting it and how quickly they can turn around. I know this month I was told by many, many school teachers and local officials that many of the walk-in clinics, not Henry Ford, but other walk-in clinics were taking 14 days to get you the result of the PCR, which at that point it's too late to be of any help. So I can see the frustration. Again, the PCR is done by, if you can find a center that will do it quickly, it is actually a very quick test. And so here at Henry Ford, we've been turning around the test in about 24 hours. But again, we're doing that for our own patients. You have to be a patient of Henry Ford to get that test. I think there are newer tests that they're developing. And again, if they use the PCR technology, we find that extremely reliable. But we are getting false negatives, and many false negatives and a few false positives with the rapid test. I think one thing I've noticed is that any of those walk-in centers that are using the rapid test, they are doing both. They're doing a rapid test and a PCR, and they give you the rapid test answer immediately, and then they follow up and tell you X days later of the PCR, because they realize there could be false positives and false negatives. So if you are getting a rapid test, I guess it's better than nothing, and definitely make sure they get the PCR at the same time, and make sure that you follow up that test result as well. Okay, well, thank you so much. It's 3:30. I'm going to let everyone go. Oh, and I see Lieutenant Fire Chief Flynn is from West Bloomfield, and I think I did meet you before. I remember giving a talk before for medical conditions. So it's been a pleasure to meet you and see you all, and I wish you the best, and I'll chat with you guys another time.